Okay, well, hello everyone. Glad you could join us tonight. We got an exciting guest here, Dr. Rahman.
Hello.
Rahman. Sorry, I keep saying it. I don't know.
Works.
It works. It works.
Actually, it's an Arabic name. It's actually Rahman, but everyone says ramen, like the noodles.
Anyways, he's a wonderful doctor here in the Toronto area at his clinic right now. So we're doing a remote, and Dr. Rahman is a Rahman. There we go. We'll get it. Yeah, we'll get it.
We got some time.
Is a natural doctor, as he's done natural doctor for 30 years now.
Almost 30 years.
Yeah, so practice. Wow, he still looks young, so he's doing all the right stuff here.
I take my own medicine, they say.
Yeah, there you go.
Right.
There you go.
Yeah.
So you've also now you also did a PhD.
Yeah.
In what's that fancy?
Biosystems or bioquantum medicine, and essentially that I studied. I had the wonderful privilege of studying quantum energy with George P. Einstein.
Oh, wow.
The actual nephew of Albert Einstein. And my thesis was based on the understanding of how energy interacts with the systems of the body to create homeostasis. And so it really, or just balance is another fancy word for homeostasis, and how all the systems come together to create that. So I've been lucky to be kind of immersed in that field of other systems, if you will, of medicine.
Yeah. So what we're going to do is we're going to start off with our video now. Sam, if you can get that to happen. Thanks. PBM stands for Photobiomodulation. Photo being light, bio meaning biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. All right. Okay. So once again, I want to introduce Dr. Rahman here. I'm thankfully been able to join him at his clinic here in Toronto. And if you're looking for a really good naturopathic doctor, an MD as well, you do look him up. It's Pinewood
Natural Health Centre.
Yes. And what area is this now?
We're in North York. And I should mention, though, that I don't currently practice as a medical doctor here in Canada. I do more the naturopathic way. And I've done that for almost 30 years now.
Right. But you got your degree in
I have my degree.
Yes,
indeed.
And he's been involved in bioquantum mechanics and has done some great stuff. Like that's his learning as well. He's got 30 years under his belt as a naturopath. So I welcome to the event tonight.
Thank you.
And
thanks for joining us.
How did we? I forget now. How did we end up meeting? What was?
It actually was another client because I learned so much from when clients speak to me.
Right.
And they bring me up to speed or up to date on things that are out there. Now, I certainly have come across a lot of different devices, and the client that came to me was a chronic fatigue patient, and she told me about the success that she was having with the helmet.
Right.
In fact, and so I said, helmet, tell me more. And she gave me your contact information,
right.
which I think as soon as I got off the phone with her, I called you and we set up a meeting.
Yeah.
You came into the clinic initially and showed me the devices.
Yeah.
Yeah. And so that was probably maybe 2 years ago now.
Yeah, something like that.
Yeah, it feels
something like that.
Time certainly goes a lot faster the older we get, I think. So,
right? I don't know if it was this older thing. It just keeps coming year by year.
Yeah, exactly. It's the thing about time; it just keeps going. All right,
but then I showed you the light technology, and you thought that was really cool. And what I thought was neat is you did your homework on it, and then.
I was grilling you with questions.
Oh yeah. This wasn't the easiest one.
It took some time and some convincing.
But that was good. And then you referred a patient my direction, and
I think shortly thereafter.
I think so.
Maybe a month later, and it was an interesting discussion because she came in and said that she had a genetic predisposition to dementia.
Right.
And this was a young lady, relatively.
Yeah.
In her 40s or 50s.
Yeah, she dark skinned, and she had some kind of lesion as well on her brain.
Right, that might have actually represented a minor stroke early on that she was not aware of.
Okay.
And so, that meant to her and to her husband as a medical doctor, and really didn't, I think, sort of believe in her sort of quest for...
I remember answering lots and lots of questions.
Right, about the use of LED light therapy. And so as I spoke to her, she got more intrigued with it. I think she called you right after my session and very quickly thereafter got herself a helmet.
Right.
Her response has been phenomenal.
Yeah, it was great. I remember she said, first of all, she came down to try it the first time, try it.
Right.
And she said the very first time she wasn't able to sleep in a long period. She was constantly waking and not getting a good sleep at all. And the night after immediately that evening into the next morning, she had the most complete sleep she's had in years.
Yeah, I mean, that's what happens when the brain finds its reset, I think, on some levels too, right?
Yeah, and you can explain it much better, obviously, than I can, but when it comes to healing, the healing mechanism, as I understand, happens a lot during sleep.
Indeed.
And so if you're lacking sleep, that's a big problem.
It's a very big problem for a lot of people, but that seems to be because we've got so much to worry about nowadays. Right?
Yeah, and if you don't have
problem.
10 extra feeds coming across your cell phone to worry about the next thing that's going on, it's overpowering.
This is true. This is true.
But her situation, I remember her telling me that she was extremely wired and aggravated during the day. She had a hard time trying to cope with life.
Mm-hmm.
And after she had the sleep, that was one part that she just said it kept doing very, very well. Now, one thing I noticed is that she covered up the fact that she had no hair. And
That's
she
right.
was, I was wondering if it was related to the ugly C word, just mentioning it that way, because I'd like to keep this interview up on the air later on.
Without medical diagnosis or treatment.
Yeah, that's
We're not
right.
making any recommendations.
That's
for medical
exactly
treatment.
right.
These are just experiences that we're sharing.
Yeah.
Anecdotally.
Exactly,
Right?
exactly.
Yeah.
And anyways, in her situation, she was so excited. Not only was she sleeping well and far less agitated during the day, she said she could take a day and it was a good day.
Right.
And so she had gotten very early on, she got one of the helmets and she started using it daily, 2 to 3 times a day. And what I remember, one of the first things she mentioned was that she realized that she couldn't do a light treatment after 6 o'clock in the evening. And because if she did it after 6 o'clock in the evening, she was so tired, she just went right to bed and never saw her husband then when he came home. So she then figured out that it had to be a treatment before supper was the last time in the evening. And then she was fine with that. That was her thing, that she just couldn't. Others can do it just before they go to bed, it doesn't matter, but in her case, it did have that kind of effect on her.
Yeah. Do you know what I love about the devices is that they are an additive. And the title of our discussion today is Integrative. And so it's an integrative part of a whole. And a whole strategy, a whole system that I had put together that was customized for her, which included the use of certain nutrients and
Absolutely.
sort of physical attributes or physical things that she was doing and taking. And just as we're talking about light is one of those essential nutrients, right?
Yeah.
Like the nutrients related to the food that we eat, the air that we breathe, right? The water that we drink. Light is just one of those other essential nutrients. You mentioned it yourself, light can heal.
Yeah. And so with what you're doing, it's so very important not to look at this as one thing.
No.
Because if you're trying to use the light to get rid of inflammation and you're drinking 10 cans of Coca-Cola,
that's right. Which is very pro-inflammatory, by the way. Yes, promoting inflammation.
And you don't want to be doing that. You want to look at your health, what you're eating, what you're drinking, and that's where it's really good to come out to a clinic with experts like Dr. Rahman and be able to really go through the whole things that you do. And there may be some things that you shouldn't be doing, and you think it's good, but you don't know that it happens to be one of those things that your body doesn't like, and causing other problems.
Right. It is part of putting the logic of a lot of this together, I feel. Right. It's like you said, they're foundational elements, and the foundation of diet is so critical and so important. We mentioned another, like sleep and exercise. Those are also critical and important things, right?
Exactly. And more recently, I'm learning a little bit about the idea of grounding. Is something that could be also helpful. So if you happen to be by a body of water and you got some sand to go into the wet sand and do a long walk, it'll be a good
or
thing.
The early morning dew in the grass as well.
Yeah, that's another one.
And a lot of this has to do with the negative ions that are actually produced in that in the grass and the dew. And that's why people flock to things like running bodies of water or Niagara Falls. for example, right?
Yeah.
And the ions that are sort of promoted and created by the running of the water over the cliff.
Yeah. So those are all good things, but with coming back to the light, we've seen lots of good things happening with using the light for all kinds of things, inflammation, and maybe you could expand a bit on, before I say something that we're up to here, but when it comes to, let's say, Parkinson's and strokes, and the common thing, one of the common things is inflammation. Do you want to speak to all the different kinds of neurological disorders or problems that?
So remember that this isn't about the treatment of conditions necessarily, and so understanding that while we have a label of a diagnosis, it's important that you work with a professional and you have an understanding of maybe what things contribute to that quote label or diagnosis. So for example, in certain conditions of the brain, neurologically, we know that there might be a circulatory component related to it. So can we use light therapy for activation of circulation? The answer is absolutely, especially our red light therapies, right? 660.
Yeah.
And so we can definitely then start piecing this together and saying, okay, well, that activates the sort of release of nitric oxide. It activates the synthesis of collagen for helping wound regeneration and healing, especially at that very sort of superficial epithelial or skin layer, it's called. And once you have that understanding of a mechanism, then you can say, well, that works because of. Now, I'm going to be the first one to say that maybe not everything has been figured out.
No. We're just scratching the surface.
In terms of how all of this mechanistically works, like we know the brain is this wonderful electrical sort of conductive system in the body, and anything energetically that you tickle the brain with is going to potentially create a change in electrical conduction. I was actually just listening to something this morning that suggested that the way that light therapies do that is essentially by changing some of the receptors in the cells that allow for things like calcium and the ions like potassium to move through the cell. And if any one of you out there knows a little bit about science, potassium and sodium, these are the things that allow electrical currents to flow. So you get better flow in the brain through the neurons, they're called, through the cells of the brain. The brain functions better, the brain heals, the brain regenerates, right? We also believe that there might actually be not just a tickling of the circulation, a tickling of the electrical currents through the brain, but there might actually be a tickling of the cells that are meant to heal the brain. They are called microglial cells. And these microglial cells might actually also respond to the stimulus of external fields, light being one of them, and another one that I love and that we use
Magnetics.
a lot. You know where I was going with this. That we use a lot in the practice also is magnetic field. And so with the magnetic field, for example, we can also do the same. We're activating the healing processes of the brain. So there you go. That's 3 different areas or 4 different areas that we can sort of elicit a response, have a response using a physical therapy like light, right? So it's part of a whole system approach that most naturopathic doctors do. We take a little bit from here, a little bit from diet, a little bit from lifestyle, and put it all together.
And then if you're able to do that, if you can reduce inflammation.
Big time.
Inflammation, and that could be in the brain, could be in your knees, it can be anywhere in your body. Absolutely. Causing all sorts of other issues that you get labels for.
That's right. And so one of the things that we understand light to do is to help reorder the way that the cytokines, that's a buzzword, right, that people are familiar with now. It's the language, if you will, of the immune system. And so there's some reordering, if you will, of that languaging within the immune system that light and physical therapies allow for us to do, including the down regulation of something called TNF-alpha, which is a very pro-inflammatory sort of process genetically even. It gets turned on in inflammation, and light turns it down, turns it off.
And other times you want to light can actually help upregulate certain things.
This is why they call it photobiomodulation, right? And it's not called biostimulation, because some things we want to stimulate, some things we want to bring down. It's regulation. So photobiomodulation or modulation is the same thing as regulation. Right?
Yeah. but up or down.
Up or down.
Yeah,
up or down.
Whatever it is.
You have to trust that the body has some intelligence in it.
Oh, it has a lot. It's a great design. I come from the
above.
yeah, yeah.
Right.
We didn't design ourselves. It's something else. What I just learned more recently is that we always looked at the body as purely electrical. That there is your nerves function electrically, and they send your stuff back and forth electrically. But now, more recently, it's been found out that light can actually travel along the myelin sheath.
That's right.
And the sheath, and along the nerve structures. So in other words, it's like, no, we just don't have a bunch of electrical conductivity, which is absolutely fantastic and wild and amazing. But we also have another whole level of fiber optics going on in the body. I think of course, the science on a lot of these, especially brain, is relatively new. I mean, we're going to discover these things. Yeah.
And as much as we know that there are certain targets of colored things, colored tissues in the body for light, and chromophores, which are actually the parts of cells that actually absorb light, I think we're going to find more. The one that's quite well known in photobiomodulation is in the mitochondria itself. That the target that we have for light therapy is actually the cytochrome oxidase C. And it's this particular part of the mitochondria, or the process of making energy, that can be sort of modulated, right, regulated. And that's what the light is fantastic for, right? And certain external agents can be applied at the same time, or certain physical things or biochemical things can be taken to activate the mitochondria. We know that the mitochondria, as much as you mentioned inflammation, and inflammation is a critical part in managing a disease state or condition, so is the mitochondria. So
yes, so I just heard, maybe a year ago, is that all these diseases are related to mitochondrial dysfunction.
Yes.
That there's not enough energy in the cell to do its job properly.
That's right.
So it's starved.
That's right.
You send out an army, and to take on a war, and if they are all starved soldiers, how good are they going to be able to do their job? But if you fill up their gas tank, so to speak, that fill up the cell with the energy the cells want and need, my gosh, they can do amazing things.
Indeed.
And how important it is, if you're talking Olympics and you're trying to be better by 1/100th of a second, to do everything you can to the body. And this is where another term that's been coming out more recently, this whole area of biostacking. So do you want to kind of explain biostacking? I think we're kind of alluding to it, but
maybe you can help me understand.
Okay, anyways, it's more of just adding multiple things at the same time.
Right. Okay.
So they call it it's a newer term, but it's been floating around. Biostacking.
All right.
Putting multiple things together to really help it, and that's what Dr. Rahman has been doing in a way. But it's just
integrative medicine.
There,
but the kids nowadays will call all kinds of things, right?
The other thing is biohacking. Biohacking is more of we're going to take control of certain things by doing things. Well, this is a better term, integrative medicine. I think.
Indeed. And it's an older term. It's been around for a little while as well, right? So it's survived the test of time. That wonderful thing we were talking about earlier.
Yeah.
Right. So mitochondrial function is fairly important. It does have a part to play in a lot of, especially the chronic conditions, the chronic disease states, the things that we don't have all the answers for.
Yeah.
Right. Chronic fatigue, fibromyalgia, multiple sclerosis, all of these conditions that have at their crux something going on with the immune system that is telling the mitochondria not to function as effectively.
Right.
And it is a layered approach. It really is. And light therapy is one of those layers.
Yeah.
Right.
One thing that's been kind of cool is to see people who have been affected by ringing in their ears and be able to see a significant drop in that noise that they hear.
Yeah, that's phenomenal, because that's a difficult condition to treat.
Another area that we're working with another hospital and group out of California is a study using light inside the mouth for oral mucositis. So people that undergo C treatment, they end up having their mouth break down, and it's like one big sore. And because of the fast-growing cells in their mouth is falling apart, and they get to a point where they can't even swallow, so they end up on feeding tubes as they're going through chemo treatments and radiation. And if they use light therapy in their mouth during that, they can avoid all those the side effects of mucositis,
Yes.
Oral mucositis, and there will be a trial going on for that. But we've already been able to find information already with people that have lost their taste and smell years ago and have it come back, and other things in burning mouth syndrome is another one. All these different kinds of things that go on, xerostomia, the loss of proper saliva flow in the mouth, improve. That's huge.
That is pretty big. Absolutely.
It's if you don't know, I mean, everybody who has proper saliva flow in their mouth, it's wonderful. But people that have lost that ability because of some kind of treatment, radiation, chemo, they start all their mouth breaks down and they lose their teeth. It's a really bad situation.
Yeah, absolutely.
And the light therapy has now been photobiomodulation, or PBM, has now been accepted, not just accepted, but understood as it needs to be a standard of care.
Ah, fantastic.
So the first time photobiomodulation has gotten another step forward as being required for a strong suggestion.
Right.
And
this is what happens when evidence starts to be accumulated
and more trials are
way.
Going on.
Yes.
So if people want to look at some of those trials, they can go to my website, SunPowerLED, and go.
You've got thousands of them there.
Yeah. Well, as a matter of fact, I'm thankful I didn't put it together, but there's 7,500 research articles.
I was impressed by that, I have to say, when I first was doing my background checks on you.
Hey,
guy.
Yeah. So some of those research articles you have to read, try and understand. They tried to break it down different ways. Some of them really didn't have as much light energy that they should have had. With devices that we have a significant amount of optical power or power density, and that's really key. Just looking how we're doing here with the time. But at this point, what we're going to do is I'm just going to go into just sharing a little bit about the products quickly, but just before we do that, I'd like to run the one video, if you could do that, please, for me, Sam.
"15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs. Well, all right. So anyways, I'm just going to take a few minutes just to explain a few things. We have 3 different Palm devices. We have the Palm Professional and the Ultimate, and both of those units have the 660 nanometer wavelength and the 810. If I can just get that one there for a moment. There we go. And just to show you what it looks like, this here, oops, there we go. And this is the 660 nanometer wavelength, and it's a bright red, and you can see it going right through my hand there. So some would say that light can only penetrate a couple millimeters. Well, they got to go back and do their homework, because they're just following some old academic articles about how deep light can penetrate, because as you can see, it's going right through this part of my hand. And my hand is obviously much thicker than a couple millimeters. But also, when you switch it over to the 810, or this is the 1050 right now, if I put a power meter on this side, I get anywhere from 10 to 20 times more optical power coming through the tissue, because the wavelength is longer. And as you go from 810 to 1050, it's a longer wavelength than 660. And you get much deeper penetration. So the Ultimate has they both look the same on your end, but we have here the 660, and here's the 810. It's a little more obvious on this device, but you still can't see it coming through. But if you could see it with your eyes, it'd be just blasting through your hand with this wavelength. We do a demonstration on some of the other videos where I actually show the light of 660 going right through a real human skull. So it's going right through the skull. So if I put the light like this, I'm going into the brain, affecting the lymphatic system that's there and increasing blood flow and many other good things. So I just also want to mention that please start thinking of questions for Dr. Rahman, and we'll get into them as soon as I finish just showing you a couple things. So this is my helmet here. This has the power level of that just comes down on top of the head, and it has the 660 nanometer wavelength. You can see how bright that is. It goes, again, through the skull, no problem, and getting into the outer layer of the brain. And as we were talking about it, the myelin sheath, the nerve connections and everything, the light can actually travel much deeper, even though we don't think of it that way because of this transport along the fiber optics of the brain or in any other part of the body. Here's the other wavelength. This is the 810 nanometer on this particular helmet. This is our regular helmet, and has the same type of optical power coming out of it as 25 joules every second. So that's the helmet. And then we have the mini canopy, and the mini canopy has the 2 wavelengths as well. It has the 660 nanometer wavelength and the 810 nanometer, or in this case, this is the this is 1050 nanometer mini canopy. Now, what's again, you really can't see that, but if you took an Android phone, right now it's totally invisible to my eyes. But if I take my cell phone here and it's an Android phone, I can see the LEDs lit up there, whereas they're not. Well, you can barely see them there.
because the cell phone, if you got a cheaper camera like what's on the Android, the 1050 nanometer can be still seen. But I can feel the energy coming from this device right now in the 1050. It's pretty substantial. And we have it where this is the equivalent power of about 15 of these palm handheld devices across this area. So about 15 times the area and about 12 times the optical power of one of these devices. So that gives you an idea of what so this works really, really well for doing larger areas like your back or legs, and works extremely well. So that is a little bit about the units we have. So we have the palm lights. Sorry, just one sec here. I'll just turn this off for the noise level. And just a little bit of fan in the background here. But now I would like to invite my guest back here, Dr. Rahman. You want to pull your...
Sure.
And we'll try and answer some of these questions. So, okay, so Ken, let's start. Let's see up here. Okay, I'm just going to go down here. One question is, can your palm units help with pancreatic C? That is something that I do not believe that we could help with, but there is some things if we can forward on to you, but also if depending on what area it is, it's something that you with proper help, there's other things you can do to slow the process.
I would certainly consult with someone for that condition.
Yeah, definitely. Okay, is there any impact on serotonin or how do you pronounce that?
Norepinephrine reuptake.
Okay.
So because it is a physical modality, there is thought that, again, as I mentioned earlier, that there are some receptor changes that can happen. And these receptors on the cells can actually change, be modified, or modulated is the word, based on the physical attributes of light and other therapies that can be applied, even magnetic field. Right? So I would answer yes, but what we're doing is we're activating neural networks, we're activating lymphatic drainage and cleaning up the sort of toxins that can potentially accumulate within the brain. You're essentially powering and helping the brain to function more effectively, and that provides a more global influence, if you will. So yes, I would say a lot of this is regulatory.
Okay, all right. I'm just going to double check my audio, make sure that just was going to check one thing here. Okay, yeah, we got good audio. I just want to make sure we're using a different system here right now, and I just wanted to make sure that everyone could hear us as the best that we could possibly do. So, yep, it looks good. So I'll just turn that off again. All right, so next question. Can you overdo treatments? Well, what I found is it depends on the type of treatment. If you got musculoskeletal type issues, where it's a physical type problems, we have had people use this like very long periods with no negative effects on it. And the right now, according to the Photobiomodulation.org, and they say that they figure there's over 100 million treatments of photobiomodulation been done in the U.S., and they do not have any written reports.
I was also listening to something like that this morning as well. Yeah, that there really isn't anything that's been recorded.
Yeah, so it's extremely safe. Now, would I suggest you take this in bed with you and fall asleep and put it, with it? No, I would not. This is something for you to use while you're awake, okay?
Right.
And sense what you're sensing. If you feel it's getting a little warm, sometimes with certain darker skins, you may find that you want to pull it back a little bit just to reduce the intensity a little bit. You then will
when you pull it back, you're still going to be treating, but you're going to treat a little larger area. So sometimes if you're starting to feel where it's getting a little hot, well, reduce it or keep moving it. Move it different locations.
And that is our built-in protection, right? Is essentially, if it is too much, you will feel pain.
Yeah.
So someone who's going to feel pain somewhere or the discomfort is not going to keep it there, right?
Yeah, and you're going to say, ouch,
yeah,
you know.
it's our gateway to for protection.
And I have some other interviews by Mark Cronshaw, and he explains the exact mechanism that creates that ouch factor, that it's too hot. It's at 42 degrees C.
It's 42, yeah.
And you can start getting at that point that feeling, but you're not going to go there. You're not going to allow. No, is it 42 or 45? I forget, but it's somewhere in that neighborhood. But well below, your body's going to say stop that, exactly. In that time. Yeah. So the other, like I say, you can always move it around a little bit as well. Okay, and by the way, I want to thank Scott and Gail and Bruce and Carla for all these questions. It's great. Okay, this may be a solution. I had a stroke and I hear neuropathy from my left arm and leg, miserable heart and heat and spikes. We've been able to see neuropathy being helped with the light therapy significantly.
Yeah.
It's been beautiful. And
I have a housebound patient who can't leave because of her pain, and it's been only about a month that she has had a device, a palm device, and it's for neuralgia that is post-herpetic, so after herpes zoster, right? Shingles, sorry.
Oh,
after
yeah,
shingles,
that's really nice.
Really does a great job, right, in reducing pain. And I think it also helps the reset, especially with chronic pain. It resets the way that the brain interprets pain. So,
yeah, and I have quite a number of dentists that are using it for lip blisters and those kinds of things on, where it's very painful. And they use the light, and they, like within 2 treatments, they can't believe that it's gone. Like it's the return back to normal without the pain, and they've been suffering pain for a long time.
Right.
So there's maybe that's part of that reset mechanism, and also helping the body's immune system to do the right things.
Right, exactly.
In
activating the immune system.
Okay, what is Dr. Mike? This is from Carla. What is your favorite way to use red light therapy in your practice? You're more newer to the use of the light therapy, but
well, I mean, in the times that I have been using it, it's really been musculoskeletal is a big one, right? The activation of anything on the surface, superficially. We do cosmetic practice here as well, and so there are some things I especially like it for. Hair loss, for example.
Oh, yes.
Is a really great way to use the helmet and to use the red light from the helmet especially.
So the one patient, that's right, I didn't complete that thought that I had, but she not only was able to have a much better life, but she ended up regrowing her hair. She was thrilled.
And that wasn't even what she really wanted it for.
No, that's not why she, but I have another dentist who actually got one of the helmets for his wife. She had a problem, and she decided that she didn't want to use it. I mean, this happens, but he was with his best intentions.
Right.
But he thought, well, maybe the helmet will make me smarter. So he used it. He used it for himself.
Uh-huh.
And what he noticed big time was his hair was extremely thin. And in 2 months, it really bulked out the hair. Uh-huh. He was really happy about what. Sure. He's more senior, and he thought that was really cool.
Oh, yeah. Again, it's one of these wonderful additive things that you could put on top of any other sort of strategy for hair or anything cosmetic. Yeah.
Bruce is asking, I just met someone whose company uses descaled fish skin for burn victims and skin transplants. Would this therapy contribute to faster healing? Bruce, very, very good question here. I can't say about the descaled fish skin. I have no idea about that side. But if you go back to some of my older videos, I do have incidents where my granddaughter, she was in the kitchen with my son-in-law, and she had mixed Jello before, and in this case, she did something different. He just finished pouring the boiling water in the bowl, and she was supposed to stir it. Instead of stirring it, she decided to pull it towards herself, and the bowl flipped and poured the boiling water down her leg. She had second and third degree burns down her leg, right down behind the knee, like it just went down her thigh and down the backside of her leg. And they had the, well, because it's my granddaughter, you wouldn't believe how fast I got the light technology over there. And anyways, she got the cream from the hospital, but they just wanted to see how things would go. And the thing was, by day 5, everything was scabbed over.
Amazing.
And by day 6, it was already, scabs were starting to fall off. And by day 8, all the scabs had fallen off, and it was just like all this new fresh pink skin.
Amazing.
So in 1 week, all these major burns. So what it does is it helps in the cross-linking to create that layer of skin back again, and it really speeds that up. So anybody with severe burns, this really helps things.
Right.
And the other thing is, the faster you can get that healing happening after a burn, the less chance of infection that can come in and cause all sorts of new problems.
Right.
And the thing was, about a month later, you could still see the discoloration where this all happened. And we got a picture. I've got a picture on the slide that shows that at the 2-year mark, you could not see that there was anything ever happening.
Right.
And the whole thing about scar tissue to help help provide proper healing and not to have scar tissue form during that healing phase. And one of the girls, she was in a tree swinging around with her friends with a rope, and she managed to lasso her hand and rip the end of the finger off on her longest finger here. And so they had to shorten the bone and then tie the skin back together again. And the surgeon had said, look, you're going to have multiple treatments on this, multiple surgeries to get rid of the scar tissue until we got it the way we want it to be. And because it was a neighbor of my daughter, she was able to get the light there next day, and she was using this light on this finger. And when she went in for 2 weeks, there was no scar tissue to remove. It was all properly healed.
And so this is, again, it speaks to the modulatory effect of this, right? This is actually helping to regulate the way the collagen is being laid down, right? The light is, and that's remarkable.
Yeah,
Great
and there's been other, like got an open heart surgery patient, and the funny part was in his case, he did it. He just thought he'd try it, see what the difference was. He had the vein stripped from his arm and from his inside his thigh. And he treated his arm every day, but he treated his thigh only once a week. The arm was fully healed, beautiful, and the skin on where the surgery was done was still puckered and still red and not perfect yet.
Right.
And
good control.
And that was over the course of 1 month. So definitely, okay. Question here. Could a person augment their PBM treatments by, for example, by first a hot tub or shower, then adding methylene blue or even DMSO in a layering effect. That's interesting. You might come out with being very blue if you use methylene blue.
Yes, it's very light sensitive. It will get activated.
Yeah, so light is methylene blue. There's a website, methylenblue.red, that people can learn more about methylene blue. But there is, I would say more, that's something that you have to check out again with somebody who's knowledgeable in this area.
On the skin, just right off the bat, I would say, we're talking about targets, and LED light, like laser, it has a target.
Yeah.
And the target is the opposite color on the spectrum. So red and blue are targets. So you're going to actually use the red light, it'll go directly to the methylene blue, it'll waste the photons. Right, I don't on the surface.
Yeah,
it'll waste the photons.
So if it's deeper, but methylene blue has also been used for toenail fungus with red light.
Okay.
So it kills the fungus in that situation.
That would probably be over time, yeah.
Yeah.
But if we wanted it for a deeper influence, I'm not sure.
Yeah, I'm not sure if that would be necessarily.
And I love DMSO topically, but in this case for light, I don't think we need the extra channels created like DMSO creates.
Okay, Marilyn is asking, I'm thinking red light therapy would be helpful for healing from knee replacement. True, absolutely. The speed of healing. Even what people have shown is if they treat pre-treatment, pre-surgery, that you can actually help stimulate the cell ready for the trauma that's coming. Mm-hmm. And so in the case of, I'm working with some, and specifically with an Olympian who, she's the oldest Olympian that almost made it one more time. This would have been the 7th time at 70 years old, but she was pulling a arrow, like a bone arrow, and 42 pounds worth, 300 times a day. Wow. This is a 70-year-old.
Wow,
she was one of those luge, went down the luge, but what if she did the light treatment before, she could feel how she did better. And as a matter of fact, she just missed the Olympics by some pre-trial stuff, but she ended up with a world championship.
Oh, wow.
So she was constantly using the light. But she also had some trigger finger, and it would help her get through, but it still wasn't perfectly improving this situation. Whatever the reason is, I don't know, but she had surgery done 2 years earlier on her other hand, and she had taken pictures, and it was really gruesome how long that it took to heal. This time she had the light, and she did the light prior to the surgery and just after, and the surgeon could not believe how well that it looked. And she showed her the picture of it was a different surgeon, but he said, this is a pretty straightforward surgery, how we do these things. There is no doubt in my mind that the red light therapy gave you a better outcome this time around. It's not because of me being a good surgeon. He said this other person was a good surgeon as well. It's just that the speeding of healing was, and so far as any time you're dealing with surgery, to use the light ahead of time is excellent.
I would agree.
Yeah. Let's continue here. Just gotta pull this up. Can this be used for successfully treating acne or wrinkles? Okay, so acne and wrinkles, yeah, it helps build the collagen, and so
especially with the red light.
With the red light, and as far as acne as well, because if you use the red light, it actually reduces the inflammation.
It's the scarring and the inflammation.
Yeah.
Blue light is actually what's used.
To
take care of like the infectious.
And so that's good. As far as the varicose veins, that's a tough one.
Yeah.
I don't know. Is there anything you've been able to do with varicose veins?
Not really.
No, it's a hard one. It's a tough one. Okay. Thank you, Gail, for your question, and James for your question. We got Grace here. Can PBM foresee patients? Is there any safety concern? Well, they've now taken that out of the picture with the more recent study of people having C in their mouth, and they've been using this light therapy, even though they have this in their mouth. They've been using this light therapy and having extremely good results inside. So no, it doesn't, even though light has been known to stimulate cells, when it comes to that kind of stuff, it doesn't increase the proliferation of the bad cells.
Right.
That's what's understood, and there's some research that's been done on that. Very good question there, James. Can you travel with the device internationally? Yes, as a matter of fact, our device has the power supply for it is a universal power supply, meaning that it runs the full voltage from as low as 100 volts to 240 volts. You just put a different, like a mechanical adapter to adapt to the pins. Most countries have that. You can get that from your travel store. They have little adapters that can fit everything. If you buy units from us, we can supply them with one of these universal adapters or specific prongs for your country. So no problem, this adapter will work on all the voltages. And as a matter of fact, as you said, how can you travel with this? Because we do not have lithium batteries in our device, because if we put a battery supply in here, it'd be so large on the back, it'd be heavy, it'd be, and then you wear out your battery and you'd have to charge it up again. We don't go with that. We plug our device in the wall because it requires a lot of energy to run off of. And the neat thing is now this kind of adapter can be plugged in on some of the international flights, and you can treat yourself on the plane. As a matter of fact, we got the 5 Mile High Club using photobiomodulation. Okay, that's for up in the sky. We've had people treating different, where they have stiffness in their neck or problems. We had,
Wow.
it's kind of funny. As a matter of fact, one of the women that was on one of the flights, she overheard me speaking to the one of the attendants, the flight attendants, and this guy had knee pain, and he was treating his knee. Because we had a really turbulent flight, we were all bound to the seatbelts. Right. So he was belted in. I was a second last. They moved me one row forward, but I was in the last row, and then he sat in the back row, the very last row, and he was treating his knee. And then when finally got through the turbulence, he got up and was starting to walk. He come back. He says, "That works so beautiful. My knee doesn't hurt." And then the woman beside me across the aisle, she says, "What is that all about?" And so she's asked me a few questions, and I says, "Oh, do you have any knee pain or anything like that?" And she says, "Nah," and I says, "Well, she said, 'Can I see it?" And I plugged it in for her. She plugged it in the thing in front of her seat, and she started putting it on her knee like this, and she's got no knee pain, but she's just doing it around her knee, right, and like that, and then she sent me a text later on. She says, "That works." The next day she says, "I wished I would have treated both knees." So she was reluctant to say that she had a problem, but it was funny. But you can run this day in, day out. If you ran this for all year, left it running continuously, you could do that for like 10 years, and the light output only dropped by about 10%. Wow. So that's 24 hours a day, 7 days a week, times 365 days, and you still wouldn't. So it can run 24/7. So you can, if you got a lot of spots on your body, you can do that. Okay, this is Tom. Hey, there's another Tom out there. All right.
I have at least 3 conditions I've been trying to treat. First, I've had tinnitus for over tinnitus, however people pronounce it, over 10 years, and I pray there's a solution out there. We have had people try it themselves, and basically just using the light with, I don't have this one plugged in, but the 1 minute of the bright red and 3 minutes of the near infrared, and doing that on daily, and we've been able to see people improve. Now, right now our numbers that have come through is about 9 out of 12 that have actually seen improvement. 3 it didn't work on, so I don't know if you would be one of the 9 or one of the 3 that didn't work, but it's possible that it could help with that condition. Second is being diagnosed with adult ADHD 4 years before retirement, and there's third, from an accident this past November with a concussion. So I can tell you that we have seen really good results with concussions, and the one fellow, like, it just helps with it helps the situation. We're not talking healing here or curing anything, but just helping people with different brain challenges.
Right. Further along, he mentions that he's got brain fog as one of the sort of main things currently, and is wondering which device might actually be of benefit.
Yeah, so any one of the palms could be used over the areas, you know, and you'd have to spend a lot more time. The helmet is actually 10 of the palm devices, so it's a lot simpler, especially when it comes to this, if you're going to be treating others in the family or yourself or whatever. But it is possible to use the palm and just spend a fair amount of time across the whole brain to cover the area. Thank you, Tom, for your question here. We do have more messages coming through, and I know we're getting on with time here. I'm going to say we'll answer a couple more questions here quickly. Joe is asking, is there an estimated time of beginning treatment to improve conditions for mild arthritis and stiff neck? We've had the full range. Everybody's different,
Right.
and sometimes you see very quick results, even in the first treatment.
Right.
Other times they have to be at it for 2 weeks before they see a change.
Yeah, it's with everything, right? You can have people that respond really quickly and those that take time. Slow
Yeah.
responders, fast responders.
Yeah. So what with people that have tried to use this for eye wellness is definitely the eyelids closed, okay? This has got the same optical power as what the sun has. So you're not staring at the sun. You have your eyelids closed, and then you can sunbathe. And guess what?
Feels really good.
It
Yeah.
feels really good. And sunbathing in Florida, they don't have any signs up that says don't sunbathe or you go blind. So as long as you close your eyelids, you're fine. And generally, if a person can, you just put it just right across, right on your cheekbone and on your forehead. If you find the bright red a little bright, they can just pull it back a little bit and find it to the comfort level. But whatever, but we've been able to see a number of eye health issues improve with the device. Okay, question from Karen, and this I'll pose back to you. Slightly off topic, but a regular cold 50 to 55 degree plunges 3 times a week. Can this help significantly with varicose veins? I've never heard of
Cold plunge?
no, I know cold plunge where
For
they.
varicose veins?
Yeah.
Significantly? I would say not.
Yeah.
Yeah, unfortunately.
No, don't know. Sorry about that, Karen. Maybe there's some more information out there, but we're not familiar with it. Okay. Brian is asking regarding using DMSO and Tom's Super Palm 1050. I noticed it made the age spots on my skin drastically diminish in less than a few treatments.
Okay.
Okay. Very.
Then we're gonna have to try that. Learn
Okay.
something every day.
So thank you, Brian, for
Yeah.
your question or your mention of that. That's extremely
Yeah, yeah.
interesting. Question for Dr. Rahman. Could light therapy be helpful for radiation-induced ulcer after colon cancer treatment? The ulcer is internally, depending on how deep, or if it's a skin, I think it might be more skin ulcer, like skin burn.
Right. Is that what
and,
you're referring to?
Well, there's radiation, it doesn't say radiation burns, but anytime there's, ulcers, we've been able to see dramatic improvement.
Assuming it's skin, yes, indeed.
Yeah, so I think that's what it is, but definitely. Well, I want to thank everybody for joining us tonight, and thank you, Dr. Rahman, for coming on.
Me.
That's been excellent.
Yeah.
And do come if you're in the Toronto area, or as a matter of fact, if you got some significant challenges, you might want to reach out, and even people travel to come to your clinic. So where have you had people come to your clinic?
All over, and all over the world. All right, so I'm Pinewood Natural Health Centre, and so if you want to look us up, that's where I'm at, Pinewood Natural Health Centre.
.ca, there you go. Okay, all right.
Pinewoodhealth.ca is actually the website.
Okay, and David is thanking you, and thanks, Tom. Great.
Thank you, guys.
May God richly bless you. Have a great week, and hopefully we can reduce some pain and inflammation in your life. So all the best. Okay, bye for now.
Thank you.